I'm a Durham native, and I come from a family where diabetes is very prevalent. My dad had 10 siblings. All of them were insulin-dependent diabetics, and most of them had had something amputated. So this diabetes project is really near and dear to my heart.
We've all seen the data on rising rates of diabetes, rising rates of hypertension, rising rates of cardiovascular disease. What is so encouraging to me about the Durham community is that our community has looked at that data and embraced it as a challenge and said, this can't go on. We can't keep having these rising trends. We have to find a way to create more health in our community.
There are really two things about this project that make it important. I mean, the primary one is that our people are dying prematurely and having disability due to diabetes and its complications. We need to do something about it.
Some tests to see how your diabetes is doing.
Okay. In Durham County, we think there is anywhere between 7 to 9% of our population impacted by diabetes, and probably another 2% that have diabetes and they've not been diagnosed. So we want to do screenings, we want to get people connected.
Durham is located in the middle of what's used to be known as the stroke belt. It's now known as the stroke and the diabetes belt, the southeastern United States. As we measure rates of obesity and diabetes and their consequences, cardiovascular disease in particular, the rates are very high in Durham County compared to other parts of the country.
We want to talk to people, we want families talking about it, because we don't talk about diabetes like we talk about not smoking.
So we have a lot of data to indicate that we have a problem. Now we need to do something about it.
Our effort is also to understand the community resources that are available. We really don't want to duplicate resources. We want to capitalize on the ones that exist. And if there are models that need to be replicated because they're best practice, we certainly want to do that.
If we develop information systems that enable us to make better decisions, both as a community and in medical care, to lower these rates of death and disability.
And then we want to understand where the gaps are in the services. So we want to build a continuum of services. Durham is rich in resources, but we want to connect those resources. And we want our residents to understand where the resources are and how to access those resources.
The part that we really need to test in this project is linking the data systems and that will allow us to figure out how to target particular areas with what kinds of interventions linked to very specific interventions.
This is a condition or a diagnosis that you can live with successfully, and you can prevent yourselves from becoming a person with diabetes by making some lifestyle changes and understanding what your family predisposition is to it, and working with your medical provider. So there are lots of things that we want to do with this Diabetes Coalition.
Well, typically we like the blood pressure to be less than 150.
We expect to see a reduction in emergency department visits and the hospitalizations that can be avoided. And in one proposal, when we looked at it, we think maybe working with this project, we would be able to save $10 to $11 million over the lifetime of a project. And so that has enormous implications for our community and for the people who deal with diabetes.
And it's not just the health system or just the health department or just community groups, it's all of those different stakeholders coming together and saying we have to change things, and we're willing to put the effort in to make something really exciting happen. So 5 to 10 years from now, I truly believe that we will see better data, better statistics on the health of the people in our community, and Durham can serve as a model for communities across the country.
This is really big. If we're able to impact the health outcomes of the entire community, quality of life goes up for many people, longevity is there, and we have cost savings.